Welcome to Omni Health Insights, your one-stop resource on all the latest healthcare developments transforming the industry. Today we have this Dr. Wael from G42 Healthcare. Dr. Wael is a consultant microbiologist and an infections control doctor. Welcome, Dr. Wael.
Thank you very much for having me, Fatma.
Dr. Wael, I'd like to start off the conversation with asking you about how COVID-19 has impacted infection diagnosis particularly.
So it's had in a strange way, a very positive impact. It's accelerated a lot of the technology, the research and development. If you recall at the beginning of the pandemic, it took sometimes 5 to 7 days to get your result. Now the expectation is you can get your result in a couple of hours. And in some instances, you can probably get it very instantaneously and immediately. So in that aspect, a lot of technology has been accelerated in that things that we thought we may have in an industrial and clinical practice years from now have already been implemented. So maybe that's the only positive thing that's come out of COVID-19.
So when you speak about these kind of innovations and methodologies which were already implemented, how were these accelerated, especially during COVID? And what do you think was a remaining factor in pushing that through?
So it's like a lot of the new sort of economic theory, there's a question of supply and a question of demand. So with the demand for increased testing and increased testing capacity supported by governments worldwide and the need to test many people at large volumes at short instances gave the incentive for the developers to work rapidly and to bring their products, their prototypes to the market, ensuring that they get tested and validated and that they are fit for purpose. So there was in a way, both a political and an economical benefit, and of course a sociological benefit in bringing these tests and accelerating the diagnostics.
In your line of work and your experience as an infections control doctor as well, what have you seen as one of the most challenging aspects of the pandemic and how it's impacted your industry?
So the whole pandemic has been challenging for everyone in every single shape or form, and one of the most important things that were challenging were the implications in mental health all around us. Keeping a steady head during this time wasn't easy. From the beginning of the pandemic, there was a lot of anxiety, as one could expect. So I think the biggest challenge would have been the anxiety associated with the pandemic and the fact that many people have not experienced such a horrendous outbreak at this scale. And most, I'd say, including people working in hospitals, we're not used to these numbers of sick patients coming at this rapidly, and unfortunately the number of death that we have seen and sickness during the period and the rates at which it happened. So all of that had an impact both emotionally, and there's been a lot of strain on a lot of people, not only healthcare staff, but people in the community, parents with schools at home. So it's all in all, one could say that it's been eye-opening and enlightening, but it's also been difficult in all different aspects.
Absolutely. And now we have the onset of a new variant, which is, I think, affecting the healthcare industry and the world globally as well. But what does it mean for diagnostics?
So what we have is we have not one variant. At the moment, they've got what they call the variants of concern and non-variants of concern. So there's a lot of variants. The question is which of them are worrisome enough for us to be considering changing whether is it our tests or vaccines or the approach, or whether or not they will cause more severe disease in populations, or will they spread to anything, or will they lead to the in a way disappearance of the virus, because you have to remember that the outcomes could go either way. With regards to the diagnostic bit of it, most of the tests that are used to diagnose the coronavirus or the SARS-CoV-2 are looking at pieces of the RNA of the virus, and the pieces of the RNA, it's called the polymerase chain reaction, PCR, we all have it nowadays, would look at particular bits and pieces of the virus, and to simplify it, it's like an adapter looking for a particular bit. If it fits, then you have the virus. If it doesn't fit, then you don't have the virus. So if you have a mutation, it might be that the diagnostic kit that is being used does not detect the virus per se, but it doesn't mean that you don't have the virus. However, And that's a very important fact, is the WHO mandates looking for more than one bit of that virus to ensure that this doesn't happen. So although mutations are happening, it is likely that most kits would at least give an indication that the virus may exist, and then there are other mechanisms and tools by which you can look for and just confirm the result, whether it's existing or non-existing.
Do you think that it could have been predicted from a diagnosis point of view? Were there early signs that were missed, perhaps?
With regards to mutations, you mean? I think, so we know from simple biology that this virus is an RNA virus, and RNA viruses lack something called the proof-reading mechanism, by which whilst they replicate, they always make mistakes in replication. So there isn't a checking, or they lack a checking mechanism whilst they do their replication. So mutations in all viruses are always there. In RNA viruses, more so than the DNA viruses, such as the coronavirus. So this is not only predictable, it's expected. Yeah. So mutations, the question is, there are different types of mutations, some that we call synonymous, which cause a change in the actual property of the virus, or non-synonymous, which doesn't cause a change in the properties of the virus. So if you have a mutation that is significant enough for it to cause a big change, is when we start worrying. Is it producing a new protein? Does it change enough to cause a different, or does it lead to the death of the virus itself? But mutations are part and part of how viruses replicate. Every single virus undergoes mutation with each replication cycle.
And what does the future hold for us in this particular situation, as mutation is something that we can't deny that's going to really just keep accelerating? Or do you feel that the new methods and innovations are going to step in and kind of curb this?
So there's been a lot of advances in diagnostics over the past, let's say, 20 to 30 years with regards to the molecular testing in particular. So now we have tools. I remember that when we used to do sequencing about 15 years ago, it would take us 4 to 5 days to just get a few kilobytes of data with a Sanger sequencer. But now with the whole genome or new next generation sequencing, you can generate gigabytes of data in a couple of days. And just like your smartphone, if you recall, moving from an old Nokia phone to a smartphone, how quick that was, the same thing has been happening to us in diagnostics, in particular in the molecular testing aspects. So from that aspect, I'd say most countries are in a relatively safe position. And if you recall that the whole genome, from the outbreak to the genome to the whole genome availability to the development of the vaccine, it took us a couple of months. So then that in itself is a major accomplishment and achievement. It's unlikely that we will not have the tools to diagnose this virus, even though it should mutate. So that is very unlikely. We might need to, and along with, of course, the organizations and developers, keep an eye on this so that we have the right necessary tools whenever they are required. But it's unlikely at the moment that identifying the virus or diagnosing it will be an issue.
Sanitization products are being mandated as a preventative measure. Do you think that they're effective, as there are some studies that are arising that they might just be not as effective as we believe they would be?
So it's, with hindsight, vision is always 6 out of 6, isn't it? So you have to always remember that infection control is multifactorial. There isn't always a magic single silver bullet that was going to work. There are transmission events occur from person to person, we know that much. From the occurrence of the virus, the amount of learning that we've had has significantly increased. The approach initially was that of droplet prevention and droplet infection control, and then the realization that a little bit more needs to be done, the introduction of masks, the increasing of the distancing, and as of yet the virus is still being transmitted. So one can only say that the combination is required, because we as of yet don't have that magic answer to say that this works better than this or this doesn't work more than that. The numbers are still increasing. Asking questions such as this are very important. However, without having the answer, one cannot advise on stopping any of them. One can only say we just have to do our best. It's We're learning day by day and improving our learning. And it's very important that we just have a bit of faith in what the scientists and the people working in the background are trying to advise us. No one has any vested interest to cause any harm or make your life more difficult by asking you to wash with alcohol or put your masks on. We all find it uncomfortable. We all find it at times unbearable even. But it is a necessary evil because there is no alternative at the moment. Once there is an alternative, then we would be able to give a differing advice.
And do you think we are nearing towards finding the alternatives at this point?
It's you're running in a race in a moving car at the moment, and the pieces keep moving every single day. You've got the economies being affected. You have people can't travel, people losing their jobs. You've got people in hospitals, beds being filled. You have delay of surgeries. So there are many factors at the moment. This remains a priority in sort of identifying if we can find the magic bullet here and find a way of preventing the infections. That would be useful. There's a lot of work being done, and when I say a lot of work, I mean a lot of work being done from studying the virus particles. We've got quite a few colleagues looking at the transmission, transmissibility, aerosolization, distances being traveled, duration of stay in surfaces, most ideal, mask types, pores. So there's a lot of work being done in all of that all together, and it's like a jigsaw puzzle. It will take shape. You will figure out what it is, but it takes time. Time that many people didn't have, unfortunately, until we got these answers. So I think the important key is what we know now is we need to prevent the ones we love more than anything. And I'd always tell people, picture that, any being lax in any of these results might lead to someone's loved one being lost. If you think you know something better, please speak to any of your doctors, scientists, and then, if you have a suggestion, people are more than willing to hear. But at the moment, the best precautions are the ones that are being advised worldwide, adopted by the WHO and by a lot of hardworking people.
Thank you so much, Dr. Wael. It was wonderful to get some insights from you about all of these, and it's a pleasure speaking to you.
Thank you very much. Thank you.